Taoiseach, following the Public Accounts Committee meeting yesterday, we learned that the health budget is in severe crisis. At the end of August, the overrun was reported as being in the order of 329 million. In September, it had increased to 374, projected to end up at 500 million by the end of the year. Now, it was RTE that told us last evening that Taoiseach Hospital had to apply to Allied Irish banks for an overdraft of 12 million, with a letter of comfort from the HSE. Yet, this was not mentioned at the Public Accounts Committee yesterday. In addition, the CEO-designate could not confirm whether the HSE had been consulted or involved in the selection of the additional primary care centres. We deduced from his reply that, in fact, officials had nothing whatsoever to do with the added primary care centres that were selected by Minister Riley. And we also know, Taoiseach, that Taoiseach Hospital is not the only hospital with a massive deficit. Across the country, acute hospitals are in dire financial straits, and that is having an impact on patients, on staff, and on people outside in the broader economy. Now, we've raised these concerns about health overruns since last April, Taoiseach, and we were told that everything was under control by yourself in this House. We all know where that has ended up, Taoiseach. The promises made on health savings have not been achieved. And that, Taoiseach, has resulted in extra cuts to home helps, for example. There are now over 1 million hours of home help has been severed from families around the country in 2012. That's the reality on the ground. And are we now facing similar cuts of a similar order across the acute hospital service? The Taoiseach CEO could not confirm that there would not be any further cuts this morning on radio. Now, Taoiseach, what I really want here is a degree of transparency on this and honesty. What is the government hiding? What is the HSE hiding? And why is the department hiding very basic facts that people are seeking? Even Minister Howland sought them 3 months ago in a letter to James Riley when he told him to get personally involved in sorting out the budget. The House now would like to know what are the implications of these overruns in terms of patient services. So can I ask you, Taoiseach, will you at least allow a full presentation by the Minister for Health to the Dáil in relation to this financial crisis in the health service, so that we can know openly and honestly what the government's approach is going to be to deal with this crisis, and if you want to take suggestions from across the House, at least that could be facilitated. But at least we need openness and a transparent approach in terms of that budget. And secondly, Taoiseach, finally, could you ask and could you ensure, in accordance with what the Taoiseach said to me last week, that in terms of the primary care centres, that you would publish all documentation in relation to the selection of those sites once and for all, so that we can get to the bottom of what happened and why a particular site in Dublin was moved from an open lease arrangement to a public-private partnership. That's all we want, basic information at this stage, Taoiseach. And that includes logarithms now as well. Taoiseach, logarithms.
You've raised a number of issues here, Deputy Martin. I think it ill behoves you to come in here as somebody who served in the Department of Health yourself.
Hold on.
I'm not going to hide behind.
Now. Thank you.
We're not going to hide behind the wreckage that you left behind, or the litany of failure that you epitomised in that department, or the litany of consultants' reports that you commissioned and did nothing about it. When this government was appointed and elected to serve the country, the Department of Health and the HSE was a completely dysfunctional organisation. We had all those health boards squashed together and the superstructure of the HSE imposed on it, which was supposed to provide the best and world-class service right across the health system. The Minister for Health found that there was no effective management, no effective financial control, no clear accountability in terms of programmes being implemented. And what's happening now is the start of a generational reform of the health system in this country. A generational reform. And nobody ever said, Deputy Martin.
Stay quiet, please.
Thank you, Deputy Dooley. Thank you, Deputy Dooley.
Stay quiet,
Nobody
please.
ever said, Deputy Martin.
Deputy Dooley, would you stay quiet?
Nobody ever said, Deputy Martin, that this was going to be transformed in the space of 12 months. That this was a very major undertaking, which it is, affecting people all over the country, and we understand that. And I listened this morning to the financial director from Taoiseach Hospital, who set out very clearly, as an example of what can actually happen here, of a hospital which had an extraordinary overrun in terms of its budget, but which has managed that to see more people more effectively give a better service, and while its budget has been cut, they still have made savings. And she clarified beyond yea or nay that nobody need be in any worries about having the provision of the best level of hospital attention given to them in that hospital, and that's one of a number. Galway's another, and every hospital wants to be in the same in the same category. So it's not a case of constant despair that you come in here every day. That's an example in Taoiseach Hospital of a hospital which has made bold decisions which are in the interests of the effective running of the hospital and of paramount importance in the sense of the treatment for the patients. The overdraft, the Taoiseach Hospital was approved in accordance with the regulations here for an overdraft until the end of the year. The actual overdraft of 4 million was cleared as was clarified this morning in January of this year. Taoiseach Hospital, for instance, Deputy Martin, achieved significant operational savings in 2012, reduced its year-on-year spending by 6%, despite having to contend with a 5% increase in inpatient numbers and a 9% reduction in its allocation for 2012. Taoiseach is an example of a hospital transforming itself to the way we want it to be, and she pointed out that by 2014 they expect to be where they want to be and where they know they can be. So if you look at some of the issues that have been raised and that are now being implemented by the Minister for Health in terms of the decisions made about the consultants, about the reform that is taking place in respect of the drugs bill, about the whole range of other issues that are in there that are under consideration now. Tomorrow I meet with the Minister for Public Expenditure and the implementation group in respect of Cork Park, and we would expect to discuss with that implementation group other issues that will bring about, in an overall sense, a reduction in the overall pay bill. So I don't accept your bleating here, and indeed the histrionics that Deputy Fleming got into yesterday at the Public Accounts Committee, which was a disgrace to any public official. It's about time they should reflect on why you didn't show some of that anger and some of that curiosity and some of that inquisitiveness when you were in charge of the department yourself.
Yes, Taoiseach, I asked you 2 questions and you didn't answer them. And that's par for the course with you. You never answer questions. You filibuster and you avoid the 2 basic questions that I asked you. I asked you, Taoiseach, in terms of the budget overrun, if you would facilitate an open and transparent debate in this House where the Minister for Health would come into the House and give a full presentation on the crisis in the finances of our health service. And Taoiseach, I don't know whether you've continued to ignore the problem, whether the government is in denial in the issue, because I'm not inventing these figures. These figures were provided yesterday, formally and officially, Taoiseach, and they paint a picture that is getting worse, and has been getting worse from the beginning of the year. Why? Because Minister Riley brought in a budget 12 months ago that was built on sand, that was dishonest and that was flawed, and has allowed the situation to get into the extreme situation it now is in. Up to 374 million at the end of September, Taoiseach. I was the Minister for Health 8 years ago, Minister Rabbit. That's, yeah, grand. We'll accept whatever you say there. I don't care what you say about the past now at this stage. What I'm interested in Taoiseach, will you, Taoiseach, will you ensure, Taoiseach, can you ensure, Taoiseach, that the House will have that debate?
Thank you.
And that the concerted attempt that's going on, Taoiseach, and it is a concerted attempt, to prevent information from coming out.
Thank you, Deputy.
To hide information from coming out. That's across the government now. And it's reflected in committees, and particularly in public accounts, on a number of issues in the last while, Taoiseach. And I also asked you, Taoiseach, the second question, will you just openly say, yes or no, that you will ensure that all documentation in relation to the selection of primary care centres will be published? Why will you not answer that question?
Thank you, Deputy.
And why would you not do that? It's a simple question. Will you publish all documentation in relation to primary care centres, the adding on of them, yes or no?
Well, the answer to your first question is yes. I've already made it perfectly clear to you and to others in the House here There will be an open debate on the financial circumstances that the country faces. Hold on a second now. Hold on a second. All you want to do week after week is to have individual ministers in here making statements. Now, can I finish my point? May I finish my point, please? You asked me a question. The week after next, the House here will discuss the economic situation that the country faces as we prepare for Budget 2013. Part of that discussion, Deputy Martin. Thank you. Part of that discussion, Deputy Martin, is to allow for contributions from everybody and anybody on health and every other matter. Now, I point out to you that the Minister for Public Expenditure wrote to the chairpersons of each of the individual Oireachtas Dáil committees. We have one dealing with health. And in that...
Sorry, if you don't mind, Taoiseach, just ignore it and come through the chair.
Thank you,
would you mind saying quiet, please? Thank you.
In his letter to each of the chairpersons, he said, a central theme of these reforms as set out in the government programme is the need to strengthen the role of the Oireachtas, in particular the Dáil Select Committees, in your important task of scrutinising the proposed allocation of public funds and indeed making a more timely and effective contribution to national budgetary and resource allocation policy. I hope that that's clear, Deputy Martin. For you at Cancora, it's an invitation as part of the programme for government for each sector, including health, to be discussed in detail by the Oireachtas Committee, which was set up for that purpose. And at that committee, Deputy Martin and any of his representatives, instead of walking out, can ask all of the questions that they wish, including the question of information about primary care centres or anything else that they wish to raise at the committee.